Unit 6, Medical Practitioner 2, Hospital Staff. The people who work in any type of workplace, including hospital, are called staff. The medical staff in a British hospital belong to one of the four main groups. A pre-registration house officer (PRHO) or house officer is a newly graduating doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor, FY1, see Unit 12. A senior house officer job is the second year of postgraduate training. The title is now Foundation Year 2, Doctor, FY2, but the old term Senior House Officer and job are still used. A specialist registrar is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registered doctors who have completed their training but do not wish to specialize yet. And a consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all the medical staff. Okay. B. Medical teams. Consultant physicians are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors, but also physiotherapists and other allied health professionals. See Unit 8. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward when they will receive treatment and care. The junior doctors clear them, take their medical history, see Unit 47 to 49, and examine them. Sometime later, the registrar also sees the patient and may order an investigation or test, for example, X-ray or ECG, make a provisional diagnosis and begin treatment. The consultant usually sees new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patient is discussed with the registrar, consultants also decide when the patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. C. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day, for example, 7 a.m. to 3 p.m., and are then free until 7 a.m. the next day. After a week, they change to a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is work from 9 a.m. to 5 p.m. every day and take turns to be on call, available to return to the hospital if necessary. From 5 p.m. to 9 a.m. the next day, days on call are set out in a row, a list of names and times. Doctors on call Carry a radio pager or beeper, a device which makes a noise when someone is trying to contact them. Exercise Unit 6. 1. Make a word combination using a word from each book. Look at A, B, and C apostrophes to help you. Associate especially house officers, on call, provisional diagnostics, radio pager, and war room. Exercise 2. Match the description 1 to 5 with the job title A to E. Look at A and B apostrophes to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to war system. Consultant. Dr. Stewart has just started the second year of her foundation program. CHO. Dr. C has started his training as a surgeon, especially registered. Dr. Feeling has just graduated and is working in a large hospital in Birmingham. PRHO or house officer. Dr. Millian is in charge of the medical staff in the Birmingham Hospital. Medical director. Exercise 3. Are the following statements true or false? Find reasons for your answers in A, B, and C apostrophes. A medical graduate becomes registered 2 years after graduation. False. The system of training doctors in British is called the Foundation Program. True. True. The name Senior House Office is no longer used in British. False. The consultant is usually the first doctors to see new patients. False. When working in shifts, all doctors take turns to be on call. False. Exercise 4. Complete the text of a PRHO describing her job. Look at A, B, and C apostrophes to help. When I get to the ward, the first thing I do is talk to the house officer who has on duty during the last shift to find out if there have been any new admissions. Then I generally see the sheriff's notes. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, collect any new patients will basically involves taking a history. On Tuesday and Friday morning, the consultant does her work stuff, and I have to make sure I complete it up to date of her patients. After that, there are usually lots of things to do, like reading up requests for blood, health visitors, and so on. In the afternoon, I have to prepare for any patients who are to be charged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the district program of Monday and Wednesday. 6. Médicos practicantes 2. Personal del hospital. Las personas que trabajan en cualquier tipo de centro de trabajo, incluidos los hospitales, se denominan personal. El personal médico de un hospital británico pertenece a uno de los 4 grupos principales. Un oficial de la casa de preregistro o oficial de la casa, que es un médico recién graduado en el primer año de formación de posgrado. Después de un año, él o ella se convierte en un médico registrado. En el sistema actual de capacitación, el programa de la fundación, el nombre de estos médicos es doctor del año 1 de la fundación. Ver unidad 12. Un oficial superior de la casa está en el segundo año de formación de posgrado. El título ahora es médico del año 2 de la fundación, pero todavía se usan términos antiguos, señor oficial de la casa y SHO. Un registrador especial es un médico que ha completado el programa básico y se está capacitando en una de las especialidades médicas. También hay algunos, sin formación, médicos que han completado su formación pero que aún no desean especializarse. También tenemos lo que es un consultor, que es un especialista totalmente calificado. Hay algunos que pueden ser especialistas asociados, médicos superiores que desean convertirse en consultores. Y bueno, para agregar, hay al menos un médico o clínico o director que es el responsable de todo el personal médico. Tenemos la parte B, que son los equipos médicos, que son los médicos consultores y los cirujanos, que son responsables de un número específico de pacientes en el hospital. Cada consultor tiene un equipo de médico joven para ayudar a atender a esos pacientes. Muchos hospitales hay equipos multidisciplinarios que consisten no solo en médicos, sino también en fisioterapeutas y otros profesionales de salud. Ver en unidad 8. Entonces, cuando un paciente es admitido al hospital, ellos usualmente ven primero a un junior doctor o un doctor joven que está en la guardia y donde recibirán el tratamiento y atención. El médico subalterno los atiende, toma su historial médico y los examina. Después, el registrador también ve a los pacientes, puede ordenar investigaciones o pruebas, por ejemplo, radiologías, también hacer un diagnóstico provisional y comenzar el tratamiento. El consultor suele ver las nuevas admisiones, personas que han ingresado recientemente en la sala por primera vez en una de las rondas regulares de la sala, cuando se analiza el manejo de los pacientes con el registrador. Los consultores también deciden cuando un paciente está listo para ser dado de alta, o sea, enviado a casa. En la ronda de sala, el consultor está acompañado por el equipo de él, una enfermera, y visitan a todos los pacientes bajo el cuidado de un consultor. La parte 3, que son los turnos, lo que sería que un doctor recién graduado trabaja normalmente en turnos, lo que significa que ellos normalmente trabajan 8 horas cada día. Ejemplo, de 7 a.m. hasta las 6 p.m. y están libres hasta las 7 a.m. del siguiente día. Ya luego de una semana o después de una semana cambian a un turno diferente, por ejemplo de 3 p.m. a 11 p.m. o de 11 p.m. a 7 a.m. El sistema alternativo es trabajar de 9 a 5 p.m. todos los días y hacer turnos para estar de guardia, disponibles para regresar al hospital si es necesario. Entonces sería de 5 p.m. a 9 p.m. del día siguiente. Los días de guardia se establecen en una lista de nombres y horas. Los médicos de guardia llevan un localizador de radio o un bleeper, un dispositivo que hace un ruido cuando alguien intenta comunicarse con ellos.